Section 4 Billing, Reimbursement, Patient Care, and Documentation of Services applies to front desk and billing employees. Section 4.1 Billing and Reimbursement. All services provided to patients need to be medically necessary and rendered with highest level of quality and care. Claims for services provided need to accurately reflect the procedures, time and units prior to submission for payment. We're considered in network with insurances that we are contracted with. We're considered out of network with all other health insurances that we do not have a contract with. Our contract with in-network insurances requires that we collect all patient responsibility including copays, co-insurance and deductibles. Copays are collected at the time of service and patients are billed for their co-insurance and deductible after the health insurance processes their claims. After a patient has received 3 final statements from the billing department and fails to issue a payment, their account is forwarded to collections. The only time we are legally able to waive a patient's copay, co-insurance or deductible is if they provide proof of financial hardship explained in Section 4.2. Patient accounts are reviewed for overpayments. Overpayments from federal payers including Medicare and TRICARE need to be refunded or have a retraction request issued within 60 days of identification. And the compliance officer needs to be notified of any overpayments from federal payers. Section 4.2 Financial Hardship. Financial hardship is the only instance where we can waive copays, co-insurance and or deductible amounts for in-network insurances. This is an unadvertised policy that is only offered upon request of patients experiencing financial hardship. Patients must complete the financial assistance worksheet located at the end of this section. And it has to be submitted and approved by the compliance officer before we can waive any patient responsibility. The patient must submit proof of financial hardship that can include pay stubs or W-2 seconds, and submitting the worksheet is not a guarantee that a waiver will be provided. A waiver for financial hardship may be granted if the following conditions are met. Waiver is not offered as an advertisement or solicitation. Waiver is not routinely offered. A good faith effort was made to determine financial need. Company has failed to collect copays, co-insurance or deductible amounts after reasonable collection efforts. Now we'll go over the types of prohibited conduct regarding patient financial responsibility. Under no circumstances will employees advertise that private insurance, or Medicare is accepted as payment in full. When verifying benefits, insurance companies always provide the disclaimer that benefit verification is not a guarantee of payment. Patient benefits can change over the course of their treatment. It's best to collect copays at the time of service and inform patients that we'll bill their insurance. And send them a bill for any remaining patient responsibility after their claims are processed. Under no circumstances will employees advertise that patients will not incur any out-of-pocket expenses. Under no circumstances will employees routinely use financial hardship forms which state that the patient is unable to pay copays, co-insurance and or deductible amounts. The financial hardship worksheet should rarely be provided to patients. Under no circumstances will employees charge Medicare beneficiaries higher amounts than those charged to other persons for similar services. The company has one fee schedule charged to all patients regardless of their insurance. The only discount allowed is the prompt pay discount for self-pay patients that must be paid at the time of service. Under no circumstances will employees fail to collect copayments, co-insurance and deductibles from a specific group of patients for reasons unrelated to financial hardship, such as to obtain referrals or induce patients to seek care with the company. Under no circumstances will employees fail to make reasonable collection efforts to collect a patient's balance.